progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
According to the World Health Organization, acute myocardial infarction remains a leading cause of mortality worldwide. My guest today is Dr. Ranjiv Choudhary. He's a cardiologist and a member of the medical staff at Palmdale Regional Medical Center. Welcome to the show, Dr. Choudhary. Tell us, what is myocardial infarction? Is this the same as a heart attack?
Indeed, it is exactly the same as a heart attack.
So then people hear the term heart attack, and they also hear sudden cardiac arrest. What is the difference between those two?
Usually, a heart attack is heralded by pressure or pain in the chest, sometimes going in the jaw or the arm, and that's how patients present to the emergency room. Either they come themselves or an ambulance is called and then the patients are brought in. That's how a heart attack may present. The sudden cardiac arrest issue is when somebody suddenly passes out or loses consciousness, and that is an electrical event where the heart becomes either very, very fast or stops, and that's a different issue altogether. Although there are, of course, relationships between the two, one may cause the other.
So when you discussed a little bit about chest pain, pain in the jaw, tell us a little bit some more symptoms that might signal a heart attack and the difference between what a man might feel and what a woman might feel.
So the classic textbook presentation is when somebody has heavy pressure in the chest, usually radiates to the left arm, sometimes into the neck, sometimes in the back. That is the typical presentation, but not everybody presents like that. A few people have no chest pain and will just have shortness of breath or will feel bad, have nausea, that type of symptom. Women are different, and they usually or very often do not present in the manner that I described. They may present with unusual type of chest pains which are not the way I described it, or shortness of breath, or just not feel well. So that is where the problem lies, in picking up women who are actually having a heart attack.
And what are some different factors that may increase your risk for a heart attack?
So the usual culprits are diabetes, high blood pressure, people that have high cholesterol, people that have a family history of early heart attack, where there may be a genetic basis, people that are obese, sometimes people that have been working extremely hard in a unpleasant environment, if it's very hot, things of that nature. So those are the usual culprits.
Is there some things with those symptoms that you described that could be confused? Because sometimes people think, oh, if they've got nausea or chest pain, they feel anxiety, a sense of dread, that it could be just a panic attack. Is that sometimes confused for people?
You're exactly right. That happens a number of times. Our normal tendency is to deny that it might be something bad. So sometimes people will feel indigestion and think that it is indigestion, and very often it might well be. But sometimes in association with that feeling, there's a feeling of dread, not feeling good, shortness of breath, sweating, not a good color, and those are not symptoms related to ulcers or stomach type of problems. They may be actually a reflection of an underlying heart attack that is starting.
And what can somebody do if they start to have those symptoms? Is there anything to do besides calling 911?
I think the best thing to do is to take an aspirin quickly if you have it available, and call the paramedics, because the sooner you come to the emergency room, the better it is. Even if it's a false alarm and turns out not to be a heart attack, that's not a problem. But if it is a heart attack, time is muscle, and we've got to get it taken care of right away.
So what do you do? What can they expect? If they call 911, what are those EMTs doing? And then what happens when they get to the hospital?
So the very first thing that happens is when the EMTs arrive, they will do an EKG and they'll take a look at that. If it looks to them that it is a heart attack, they will transmit the EKG to the emergency room. So the emergency room physician is already prepared that there may be a patient coming in with a heart attack. Once he realizes that, he will activate the cardiac catheterization team and let one of us know that there is a patient coming in with a heart attack. And as soon as the patient comes in, he is very quickly assessed and rushed to the cardiac catheterization laboratory so that we can take a look at the arteries, and if there is a blockage, we can open the blockage, save the heart muscle quickly, and make the patient well again.
So you mentioned that time is heart muscle. So based on how quickly you can get to this patient, you can save some of that heart muscle. What happens after the fact? I mean, after you've done some of your treatment, then what's life like for that patient?
If the patient comes in quickly and the diagnosis is made quickly and the patient is taken to the cardiac catheterization laboratory and we are able to successfully open the artery, then the muscle is saved. And often there is very little damage to the heart. And once the patient is able to leave the hospital, which is soon rather than later, then they can, within a few weeks, resume a perfectly normal life and live a good, healthy life.
So do you recommend cardiac rehab after the fact?
We usually instruct patients on rehabilitation. They are not typical rehabilitation centers anymore that do cardiac rehabilitation like they used to be, and that's an insurance type of issue. But we'll usually tell the patients what they can and cannot do and how to increase their activity and get back to normality. And often, if the work is done quickly and there is little damage, there isn't a great need for extensive cardiac rehabilitation.
So what lifestyle changes would you like to tell people about to either prevent acute myocardial infarction, or if they have suffered one, what you want them to change in their lives afterward?
So there are a few things in this regard. First of all, obesity is quite a problem in the United States. So obviously, control of weight and loss of weight is important if a person is heavy. Then in concert with that, diet has to be implemented. So less food and better food, less in terms of fast food, fatty food, more healthier diet, vegetable-based diet, salads, things of that nature. So that's the diet issue. And then daily activity, I'd recommend typically half an hour to 45 minutes of modest walking and exercise in the gym, if possible, once the patients have recovered from their heart attack. And finally, take their medication on a proper, regular basis as prescribed to them. Do not smoke. Drink little, not a lot, and follow up with your physician on a regular basis, where they would monitor the blood pressure, cholesterol, control of diabetes, those types of issues.
In just the last few minutes, Dr. Choudhary, what should people who have suffered a myocardial infarction think about after their initial care? What would you like them to think about?
Well, I'd like them to think about a few things. First of all, they've got to keep active, and they mustn't focus on a day-to-day basis on the heart. They need to move on with their life, but do the things that are recommended. Once that happens and they stay well, what happened to them with the heart attack recedes to the background, and the anxiety and the stress goes away, and they can live a normal, healthy life, which is what we want them to do.
And why should they come to Palmdale Regional Medical Center for their care?
They should come to Palmdale Regional Medical Center because we have an excellent emergency room which recognizes heart attacks quickly and activates the system so that we can take the patient to the cardiac catheterization laboratory. The laboratory is very good staffed by compassionate people who are there to serve the patients. They come quickly to help the patients and treat them with kindness, courtesy, and respect. And the same is true for the nursing staff. And if they have a good experience, which patients do, then it's a better thing for them than if it was a not good experience.
Thank you so much, Dr. Choudhary. It's really great and such important information. You're listening to Palmdale Regional Radio. For more information, you can go to palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.